This is one of those issues people, I think, are really passionate about. Ohioans getting ready to vote on legalizing recreational marijuana. 3 issues about the drug came up this week.
One involving safety, another involving regulation, and a third involving how cannabis companies deal with banking. Our senior health correspondent, Monica Robbins, breaks it down.
The Department of Health and Human Services formally recommended that the Drug Enforcement Agency ease marijuana restrictions, remove it from being a Schedule I narcotic to a Schedule III.
It would remove the applicability of Section 280E of the Internal Revenue Code, which prohibits people who are selling or producing Schedule I or Schedule II substances from taking their ordinary business deductions on their tax returns.
Congress is working on making it easier for banks to work with cannabis merchants. In Ohio, they do have access to smaller banks and credit unions, but they pay higher fees and interest rates. A vote may come by September.
Ideally, provide greater access to larger financial institutions to take deposits from cannabis operators, to lend into the cannabis industry, and it may also open up greater access to public markets.
Finally, a new study revealed marijuana users had higher levels of lead and cadmium in their systems compared to those who didn't smoke pot or cigarettes. The research looked at data from 2005 to 2018 and didn't distinguish if the marijuana used was regulated, which would limit contamination.
Products don't make it to dispensaries to be sold unless the operator can verify through third-party testing that they are safe, that they don't exceed or don't have heavy metals or other harmful substances.
Now, I reached out to Dr. Ryan Marino, a toxicology and addiction specialist at University Hospitals, who happens to be speaking at an international drug conference in Scotland. He told me in an email that concerns like these are good arguments for legalizing cannabis as the only way to reliably treat and prevent toxic exposures like heavy metals. As for the DEA decision, the last time they investigated marijuana descheduling, Heran says it took them 2 years to decide to keep it a Schedule I drug. So we're just going to have to wait and see, Christy.
Yeah, people forget there's so many moving pieces and parts to all of this. Monica Robbins, thanks for walking us through it.